Hi, this is Dr. Hutch, and this is the second installment of Nervous System Part 2, where we cover the peripheral nervous system in more detail. Okay, so the peripheral nervous system consists of the nerves that connect the central nervous system to other body parts, and this includes the cranial nerves that arise from the brain and the spinal nerves that arise from the spinal cord. The subdivisions of the peripheral nervous system include the somatic nervous system and the autonomic nervous system. The somatic nervous system are cranial and spinal nerves that connect the central nervous system to the skin and skeletal muscles. So this is under conscious control. Autonomic nervous system are the cranial and spinal nerves that connect the central nervous system to the viscera, or your organs, and this is for subconscious activities. I like to always say that autonomic is automatic. Okay, and this table gives you a brief overview of the subdivisions of the nervous system. And we'll cover these in a little bit more detail. So the structure of the peripheral nerves, we're really talking about bundles of axons. So that's what a nerve is. So nerve fibers, when we say that, are axons. It does have connective tissue coverings like all of the tissues we talk about. The endoneurium is loose connective tissue that surrounds the individual axons. The perineurium are loose connective tissue that surrounds the fascicles, and epineurium are dense connective tissue that surrounds a group of fascicles. This figure shows you the organization of a nerve and the different connective tissue coverings. We can classify nerve fibers by their function or their origination. So by function, you've got sensory nerves that conduct impulses into the brain or spinal cord. Motor nerves conduct impulses to muscles or glands. And then you have mixed nerves that contain both sensory and motor nerve fibers. Most nerves are mixed nerves, and all spinal nerves are mixed nerves, except the very first pair. As I said, we can classify by origination too. The cranial nerves originate from the brain, and the spinal nerves originate from the spinal cord. So we'll start with cranial nerves. There are 12 pairs on the underside of the brain, and most of these are mixed nerves. Some are sensory, associated with special senses. Some are primarily motor, and they innervate muscles or glands. And most are attached to the brainstem with two exceptions. The first pair has fibers that start in the nasal cavity. The second pair originates in the eyes. These are fibers that synapse in the thalamus. The cranial nerves are numbered with Roman numerals 1 through 12, from anterior to posterior, for the two pairs associated with the cerebrum, and from superior to inferior for the remaining pair. Okay, and this figure shows you all of those cranial nerves, and you should get to recognize these. Know both the names as well as the numbers. Let's go over functions. The olfactory nerve. It's sensory nerve only. It's associated with a sense of smell. We have bipolar neurons, so the olfactory receptor cells pass through the cribriform plate of the ethmoid bone, and they enter the olfactory bulbs. Okay, the optic nerve, number 2. This is sensory nerve only. It's associated with a sense of vision. The neuron cell bodies form the ganglion layers of the retina and pass through the optic foramina of the orbits. The oculomotor nerve, number 3. Motor nerve with some proprioceptive fibers. Motor impulses go to several voluntary muscles that raise the eyelids and move the eyes. Motor impulses to the involuntary muscles also that focus the lens and adjust light entering the eye. This is part of the autonomic nervous system. Trochlear nerve, number 4, motor nerve with some proprioceptive fibers. It's the smallest pair of cranial nerves. And the motor impulses do go to one pair of muscles that move the eyes. Okay, the trigeminal nerve, number 5. This is a mixed nerve. It's the largest pair of cranial nerves. There's 3 large sensory branches. The ophthalmic division. This is sensory from the surface of eyes, tear glands, the scalp, forehead, and the upper eyelids. The maxillary division. This is sensory from the upper teeth, upper gum, upper lip, the palate, and skin of the face. And then the mandibular division. This is sensory from the scalp, skin of the jaw, lower teeth, lower gum, and lower lip. Motor impulses go to the muscles of mastication. This figure shows you cranial nerve number 5, the trigeminal, with its different branches. The abducens nerve, number 6. It's a motor nerve with some proprioceptive fibers. Motor impulses go to one pair of muscles that move the eyes. Facial nerve, number 7. This is a mixed nerve. It has sensory impulses from the taste receptors and motor impulses which go to the muscles of the facial expression, tear glands, and salivary glands. This figure shows you cranial nerve number 7, facial. Vestibulocochlear nerve number 8. It's also called the acoustic or auditory nerve. It's a sensory nerve only, and there's 2 branches. The vestibular branch is sensory from equilibrium receptors of the ear. The cochlear branch is sensory from hearing receptors. The glossopharyngeal nerve number 9. This is a mixed nerve. It's sensory from the pharynx, tonsils, and part of the tongue, which is the region of the posterior to the nasal cavity, oral cavity, and larynx. Also, there's motor impulses to salivary glands and muscles of the pharynx for swallowing. Vagus nerve 10. This is a mixed nerve. Somatic motor impulses go to the muscles of the pharynx and larynx for speech and swallowing. The autonomic motor impulses go to the heart and other viscera of the thorax and abdomen. The sensory go from the pharynx, larynx, esophagus, and viscera of the thorax and abdomen. This figure shows you cranial nerve number 10, the vagus. Accessory nerve number 11. Motor nerve with some proprioceptive fibers, and it's formally called the spinal accessory. It contains cranial and spinal branches. The cranial branch joins the vagus nerve. The motor impulses go to the muscles of the soft palate, pharynx, and larynx. And the spinal branch. These are motor nerves to the muscles of the neck and back, and small sensory component is the proprioceptive fibers. The hypoglossal nerve number 12. These are motor nerves with some proprioceptive fibers, and the motor impulses go to the muscles of the tongue for speaking, chewing, and swallowing. Okay, table 11.9 goes over the functions of the cranial nerves, and this would be a good chart to get to know as well in studying. All right, let's look at the spinal nerves. All of them are mixed nerves except the first pair, which is entirely motor, and they originate from the spinal cord. There's 31 pairs of spinal nerves, the 8 cervical nerves, C1 to C8, 12 thoracic nerves, T1 to T12, 5 lumbar nerves, L1 to L5, and 5 sacral nerves, S1 to S5, and then finally 1 coccygeal nerve. The cauda equina is formed by descending roots of lumbar, sacral, and coccygeal nerves. A dermatome is an area of skin innervated by the sensory nerve fibers of a particular spinal nerve, and it's in all spinal nerves below C1. Okay, this graphic shows you the different spinal nerves, the different regions. This figure shows you the dermatomes, where nerves innervate. Each spinal nerve splits into an anterior and posterior root inside the vertebral column. The anterior, which is ventral or motor root, contains axons of motor neurons whose cell bodies are in the spinal cord. The posterior, dorsal or sensory root, contains axons of sensory neurons. The posterior root ganglion contains cell bodies of sensory neurons that conduct impulses from the periphery into the spinal cord. The spinal nerves are formed by union of anterior root and a posterior root. These are mixed nerves. Branches of the spinal nerves outside the spinal cord include the meningeal branch, the posterior branch or ramus, the anterior branch or ramus, and the visceral branch, which is only in the thoracic and lumbar areas. This figure shows you the spinal nerves and their branches, anterior and posterior rami. Okay, the nerve plexuses. So a nerve plexus is a complex network formed by anterior rami, or branches, of the spinal nerves. It's not in T2 through T12. Instead, the anterior rami become intercostal nerves. The fibers of various spinal nerves are sorted and recombined, so all fibers heading to the same peripheral body part reach it in the same nerve. There are three nerve plexuses: the cervical, the brachial, and the lumbosacral. The cervical plexus is formed by the anterior rami, or branches, of C1 to C4 spinal nerves and lies deep in the neck. It supplies muscles and skin of the neck. C3, C4, and C5 nerve roots contribute to the phrenic nerves, which transmit motor impulses to the diaphragm. This figure shows you the spinal nerve plexuses. The brachial plexus is formed by the anterior branches C5 to T1 and lies deep within the shoulders. There's 5 major branches of the brachial plexus: the musculocutaneous nerve, which supplies muscles of the anterior arms and skin of forearms; the ulnar and median nerves, which supply muscles of the forearms and hands and the skin of the hands; the radial nerve, which supplies posterior muscles of the arms and skin of the forearms and hands; and the axillary nerve, which supplies muscles and skin of the anterior, lateral, and posterior arms. This figure shows you the brachial plexus. The lumbosacral plexus is formed by the anterior branches of L1 to S4 roots. The lumbar portions are in the lumbar region of the abdomen, and the sacral portions are in the pelvic cavity. Major branches of the lumbosacral plexus include the obturator nerve, which supplies motor impulses to the adductors of the thighs; the femoral nerve, which supplies motor impulses to muscles of the anterior thigh and sensory impulses from the skin of thighs and legs; and the sciatic nerve, which supplies muscles and skin of the thighs, legs, and feet, and it's the largest and longest nerve in the body. This figure shows you the lumbosacral plexus. Okay, spinal nerve injuries can be caused by birth injuries, dislocations, vertebral fractures, stabs, gunshot wounds, or pressure from tumors. In the case of whiplash, this is sudden bending of the neck, which causes a compression of the cervical plexus nerves, and this leads to persistent headache, pain in the neck. Broken or dislocated vertebra in the neck can sever or damage axons leading to the phrenic nerves, and this can result in paralysis of the diaphragm. The thoracic outlet syndrome. This is pressure on the brachial plexus due to continuous flexion of the arm, as in painting or typing. This results in pain in the neck, shoulder, and upper limb. Sciatica. This is compression of the intervertebral disc in the lumbar region and results in pain in the lower back, the gluteal region, and maybe the thigh, calf, and foot. And then carpal tunnel syndrome, which you've probably heard of, which is caused by repeated movements of the hand, which inflames the tendons that pass through the carpal tendon, or the carpal tunnel, which is space between the bones in the wrist. You get a swelling in the tendons which compress the median nerve, and this results in pain in the arm and wrist. Yeah, let's move to the subdivisions of the peripheral nervous system. So the autonomic nervous system. So this is an efferent motor part of the peripheral nervous system, and it functions without conscious effort. It controls visceral activities. It regulates smooth muscle, cardiac muscle, and glands, and helps maintain homeostasis. It also helps the body respond to stress and prepares the body for exercise and intense physical activity. Some general characteristics of the autonomic nervous system. The hypothalamus exerts the main control over the autonomic nervous system. Reflexes in which the sensory or afferent nerve fibers transmit signals from the viscera and the skin to the neural centers in the central nervous system regulate some of the autonomic nervous system activity. In response, the motor or efferent impulses travel through the cranial and spinal nerves to the ganglia outside the central nervous system. Impulses continue to the muscles or glands, which respond to nerve impulses by contracting, secreting, or being inhibited. There's two divisions of the autonomic nervous system, the sympathetic and the parasympathetic. The sympathetic division prepares the body for fight or flight situations, and it's most active under energy-requiring, stressful, or emergency situations. The parasympathetic division prepares the body for rest and digest activities. It's most active under resting, non-stressful conditions, and most organs receive input from both divisions. Okay, when it comes to the autonomic nerve fibers, all of the neurons are motor or efferent. The somatic motor pathways link the central nervous system and a skeletal muscle fiber through one neuron. The autonomic motor pathways contain a chain of two neurons, a preganglionic fiber and a postganglionic fiber. The preganglionic fibers are axons of preganglionic neurons. The neuron cell bodies are in the central nervous system, and the axons leave the central nervous system and synapse in the autonomic ganglion. The postganglionic fibers are axons of postganglionic neurons. Neuron cell bodies are in the ganglia, and axons extend to the visceral effector. This figure shows you the somatic and autonomic motor pathways. The sympathetic division. This is in the thoracolumbar division, T1 to L2. Preganglionic fibers originate in the spinal cord, and they leave via the ventral roots, and they leave spinal nerves through the white rami and enter the sympathetic chain or paravertebral ganglia. The sympathetic chain ganglia plus the fibers that connect them make up the sympathetic trunks. The sympathetic chain ganglia lie some distance from the viscera they regulate. Other sympathetic ganglia, such as collateral ganglia, are close to the viscera. Postganglionic fibers, or axons, run from the sympathetic ganglia to the peripheral effectors. This figure shows you the sympathetic chain ganglia of the sympathetic trunks. Okay, in the sympathetic division, the preganglionic fibers may do any of the following. They can synapse with a postganglionic neuron in a paravertebral ganglion. They can continue through a paravertebral ganglion and synapse at another sympathetic ganglion, and they pass through or can pass through to the collateral ganglia to synapse there. Postganglionic fibers. They extend from the sympathetic ganglia to visceral effector organs. The postganglionic fibers that originate at the paravertebral ganglia usually pass through the gray rami, and they return to a spinal nerve before proceeding to an effector. An exception, the preganglionic fibers pass through the sympathetic ganglia and extend to the adrenal medulla. These terminate on hormone-secreting cells that release epinephrine and norepinephrine. This figure shows you the sympathetic fiber pathways. This figure shows you the sympathetic division of the autonomic nervous system. All right, now the parasympathetic division. This is the craniosacral division of the autonomic nervous system. Preganglionic neurons originate in the brainstem and S2 to S4 spinal levels. Preganglionic fibers extend out on the cranial or sacral nerves to the terminal ganglia, which are near or in the visceral organs. Short postganglionic fibers continue to specific muscles or glands. The preganglionic fibers of the head are included in oculomotor, number 3, facial, number 7, and glossopharyngeal 9 nerves. Preganglionic fibers of the thorax and abdomen are parts of the vagus, number 10 nerve, which contains about 75% of all the parasympathetic fibers. Preganglionic fibers of the sacral S2 to S4 region of the spinal cord carry impulses to the pelvic viscera. This figure shows you the parasympathetic division of the autonomic nervous system. All right, let's talk about autonomic neurotransmitters. Cholinergic neurons release acetylcholine. All preganglionic sympathetic and parasympathetic fibers are these, and postganglionic parasympathetic fibers. Adrenergic neurons release norepinephrine, also called noradrenaline. Most of the postganglionic sympathetic fibers are these. Okay, this graphic shows you the different autonomic neurotransmitters. Okay, most organs are innervated by sympathetic and parasympathetic divisions with opposite actions. So actions result from binding to protein receptors in the membrane of the effector cells in the synapses, or a neuromuscular junction. Cholinergic receptors bind to acetylcholine, and there's two types. Muscarinic receptors are excitatory and slow, and also activated by fungal toxin muscarine. The nicotinic receptors are excitatory, rapid, and they are also activated by tobacco toxin, nicotine. The adrenergic receptors bind to epinephrine and norepinephrine, and there's two types, alpha and beta receptors, and they elicit different responses on various effectors. So after acting at a synapse or a neuromuscular junction, neurotransmitters must be removed or inactivated to prevent continued stimulation of the postsynaptic cell. The enzyme acetylcholinesterase decomposes acetylcholine, which is released by cholinergic fibers. Norepinephrine from adrenergic fibers is removed from the synapse by active transport, and it's inactivated by the enzyme monoamine oxidase. Okay, control of the autonomic activity is controlled largely by the hypothalamus. Control of the autonomic nervous system is involuntary. The medulla oblongata regulates cardiac, vasomotor, and respiratory activities. The hypothalamus regulates visceral functions such as body temperature, hunger, thirst, and water and electrolyte balance. Autonomic reflex centers occur in the medulla oblongata and the spinal cord. Reflex centers in the medulla oblongata control the cardiac, vasomotor, and respiratory activities. The limbic system and cerebral cortex control emotional responses. All right, let's talk about lifespan changes of the nervous system. So the brain cells begin to die before birth due to apoptosis, which is a form of normal programmed cell death. Over average lifetime, the brain will shrink 10%. More gray matter than white matter is going to be lost with aging. Many cells die in the temporal lobes, but few in the brainstem. By age 90, the frontal cortex has lost half its neurons. The number of dendritic branches in the cerebral cortex decreases, and decreased levels of neurotransmitters occurs. Action potential's propagation rate declines by 5 to 10%. You start having fading memory. You have a slowed response and reflexes. You have an increased risk of fainting and falling, and changes in sleep patterns that result in fewer sleeping hours. And that is the end of nervous system part 2 presentation.